I've been a nurse and nurse leader for more than 3 decades. A large array of experience in my career. I've got all the academic credentials. I say all that not to go through the accolades of that. There's an and to that. And that and is, I've struggled with my mental health pretty much all of my adult life. And and I didn't know, for many years I suffered or struggled in silence. I wouldn't tell anybody. I would mask it well, show up and be present, with my teams and lead those teams and inspire. And deep inside, I knew that I had chronic suicidality. And I'm a suicide survivor, having attempted multiple suicide attempts over the course of most of my career. It was April of 2022. Sat in a parking lot with my wife. We were about to go on a walk, and I said, Karen, I don't know if I'm going to be alive at the end of this year. And it was very emotional. It was probably one of the last cries for help I felt like I could have. So it was there that I ended up, reaching out, and I talked to my PCP, entered a 90-day residential treatment facility, and really learned a lot. That was really the first time that I actually got a diagnosis with everything that I was feeling and doing throughout my life. Now I've got a diagnosis associated with it. I was in a major depressive disorder, complex PTSD. A lot of the emotions that I was feeling through there was that I would never be good enough. Always question my worth. Am I really worth being here? Would teams be better off without me? It's a lot of that negative self-talk, the negative core beliefs. But I learned a lot in that 90 days. As I went into the 90-day treatment program, I sat down with my team and said, hey, I'm struggling, and I'm struggling hard. I really need some help. But by opening up to my team, what I found is that others on my team were struggling. And as I met with them in one-on-ones, they said, I've had some of these same feelings and I'm going to receive therapy. Another said, I'd never thought I needed therapy, but I am going to receive therapy. And then they come back and say how much of a blessing that was. Creating those psychologically and emotionally safe spaces for people to have that sort of conversation became important. And then I became even more open in sharing my story on LinkedIn and other social media platforms. And again, people from across the country and even around the globe would reach out to say, I've never told anybody my story and what I've been struggling with, and this is the first time. And I thank you for that. So that sort of impact, that difference, that I can help somebody else perhaps not go through what I did, or to be able to recognize that it's okay to not be okay and to receive the help that they would need. Recently did a presentation and shared my story, but I did ask how many people here have attempted suicide, and the numbers of hands that went up. It was pretty daunting, And we know that 70% of people globally have experienced some sort of trauma in their life. We need to rehumanize leadership and the care that we're providing. That sense of purpose. How are we taking care of our patients and their families and each other, and creating, that sort of psychological and emotional safe space. To be able to think about mental health, to decrease or eliminate the stigma associated with it, so you didn't have to struggle in silence. You can be transparent and work through that. And have those conversations similar to the conversations we have around other chronic diseases. I can sit at a dinner table and people say, well, I need to check my blood sugar. We don't have those kinds of conversations when it comes to our mental health, and that we need to pause for a second and catch ourselves. And I've been taught that if you approach everybody you come into contact with as if they're struggling with something, about 90% of the time you'll be right. And so how can we be a little more kind to the people that we come into contact with?